Association of Suicide Prevention, Gasp, trains media on ethical suicide reporting in Ghana. The training by Gasp marks a crucial step in enhancing the role of the media in suicide prevention, ensuring that coverage is responsible, sensitive, and supportive of mental health efforts in Ghana. In a significant move towards addressing mental health issues in Ghana, the association has held a media training to educate journalists on the do's and don'ts of reporting suicide cases. The initiative follows the passage of the Criminal Offences Amendments Bill on March 29, 2023 by Parliament, which decriminalizes attempted suicide in Ghana. Under the new law, attempted suicide is now considered a mental health issue requiring legal assistance rather than a crime. The training aimed at guiding media personnel on appropriate and sensitive suicide reportage emphasized the importance of adhering to guidelines that ensure accuracy and sensitivity. GASP, a leading organization in suicide prevention and mitigation, urged journalists to exercise caution in their reporting to avoid causing harm to vulnerable individuals.
But I think maybe the motive for this question is to find out how has it been helpful. Yeah. Yes, it's over a little over a year now since that law was repealed. Now we are looking forward to now setting up together a national database of suicide and attempted suicide so that we can keep tracking whether or not this law is actually helping to reduce the behavior or encouraging more efforts towards prevention of suicide in our country. And so I think that for now, maybe 1 year is too short a time because we have not done much in terms of data collection so that we'll be able to measure in numerical or statistical terms exactly what the benefits has been. But I can tell you that on our part as researchers and advocates and interventionists and preventionists, the law has been good. The repeal, it has been good, and we're hoping to do more and to support government to do more in terms of suicide prevention and intervention in Ghana. Law will not catch them, and so they can walk to the hospital, walk to a therapist, go to a friend, go to a relative, go to a pastor, go to an imam, walk to anybody and seek help. So decriminalization, topmost importance is that it encourages help seeking for mental health challenges and emotional problems and for solution for crisis or psychosocial problems. The other is that it helps us to get accurate data. Now, if suicide is a crime and your friend, your loved one, your relative dies by suicide and you take the dead body to the hospital for preservation, you are not going to tell the health authorities that the person died by suicide because the act is a crime. You know you'll be incriminated by the law. The police must come in and investigate and things like that. You are not ready for that. So you go to the hospital with the dead body and you will change the narrative and say, okay, it was just through accidents. That way we are losing data and government will not be able to plan for intervention and prevention of suicide. And so decriminalizing attempted suicide is a good step and also in the right direction because then it will make other stakeholders come on board to support government, engage with government, to invest properly into our mental health system and to invest generally in our health system so that we can provide care and support to our people. Remember, health without mental health is no health. In other words, there can be no health without mental health. We tend to focus so much on our medical and physical health to the neglect of our emotional and psychosocial needs and health. So it's important that we pay attention to that. And that can happen also when we decriminalize attempted suicide. So the decriminalization that we have experienced in Ghana is very good, but it is not just enough to stay there. We have to keep working and engage with our communities, engage with our people. And it's important to do that because it is just the law that has been decriminalized. What about our churches? That's all Christian faith that still says that attempted suicide is a crime or suicide is a sin. What about our Islamic teaching that suggests that when you attempt suicide, it is a sin? All of these ones, we need to change them. Then our own traditional setup where attempted suicide is a taboo. and where it is prescribed, we need to keep working, engage with our stakeholders, our opinion leaders, our traditional leaders, to help sensitize our people and make sure that we educate them and help them develop empathy. We help them develop supporting spirit, keeping and looking out for one another so that we can support each other and meet our emotional needs. Ghana is multilingual, of course, and our formal language is English, but I think that it isn't everybody that will speak English in Ghana, even though education has come far in our country. So, as part of our plans, we also want to be sure that the recommendations that we have adapted from the WHO will be further broken down into our various local languages, or at least our major local languages that are spoken or taught in our schools and so on. And particularly also for those that are used on our airwaves, radio and television, so that we can continue to engage media people and engage the public using the language that everybody understands. Of course, English is good, but we also need to make sure that locally people can appreciate the content of what is happening and how we can talk about suicide and how we can engage with the public with the right kind of language that will inform empathy, that will inform sensitivity, and also bring us all together towards suicide prevention. So the Association for Suicide Prevention Ghana, Gasp, from now will be looking to extend this training, engaging with the media professionals on how to apply the reporting scorecard and the reporting recommendations when it comes to suicide in the media. We have done this, or we are doing this today in the Greater Accra region. We are hoping to extend this to 4 other regions. In total, it will be 5, and it's mainly due to financial constraints. We are unable to do all the 16 regions, but we hope that after 5 regions, in September, precisely on September 10, which is the World Suicide Prevention Day 2024, we will formally launch these 2 resources so that media people from across the various platforms can engage with the materials when it comes to reporting suicide on their platforms. Then going forward, we're hoping to engage more with communities, engage more with their religious bodies in terms of how we can further stop having negative attitudes towards suicide and suicidal persons. We need to show more empathy. Sometimes we just need to listen. We don't need to talk. People come to us and they are experiencing suicidal crisis. We just need to listen to them. We don't need to condemn them. Those attitudes of condemnation, trivialization are not helping. In fact, they put people rather into the deeper quarters of engaging in suicidal behavior. So more public engagement, more engagement with our stakeholders, particularly the media professionals, and of course our health systems, so that we can collect more reliable and meaningful data to support our work and also support government in planning, intervention and prevention efforts in the country towards suicide prevention.
So the name is Enel Skateno, and I'm here on the ticket of PCG TV, and I also participated in the Gasp program. Yes, so about suicide, and we are trying to put in the minds of Ghanaians what it means to not promote suicide in the country. Some time back we didn't even know that suicide, talking about it too much, would infuse or put in the minds of our people that, okay, this is not good, it would cause more suicide or people would take their lives. But we are now learning what it means to actually curb it. So there are ways you can promote but not let people commit. There are ways we are not supposed to use anymore in the media space, like commit and all those things. So right now we've learned so much, and I'm taking something back. I know moving forward I would say less when it comes to people's death and try to engage or direct people to Gasp. That is where they would need the help, because right now we know they are there. So every media institution should just follow that trend.
Well, my name is Joseph Nanaya Okobna from the Insight newspaper. Basically, what we learned today has broadened my scope in terms of how to report accuracy on suicide. Sometimes we as journalists, we are always in the haste to report bad news. And why am I saying it's a bad news? Because somebody's downfall should not be a wake up for you to just go out there and report certain things. We need to exercise restraint in terms of reporting suicide issues. Thank you, my brother.
Thank you for watching Nation One TV. Kindly subscribe for more news updates.